Today, what is it that we can do?
In September last year, I broke my leg over here, the small bone, and I still have problems with that. It's still not very comfortable in my foot.
So when did you have the accident?
September the 10th.
So September the 10th. So we're about 5 months ago, 6 months ago.
Yes, and I didn't know it was broken, so I walked on it for 4 weeks. Then I went to the hospital here in the Netherlands. I fell in Sweden, and I went to the hospital. They said it's not broken. I said okay, it's good, but it was broken.
It was broken. Okay. Okay. So we're dealing with something that's wasn't well treated. So there's probably also a lot of compensation. There's lots of other pain that's around it. Okay. So can you show me with your index finger where you have pain now? That's fine, yeah.
Yeah, it's different every day. Now it's here.
Okay.
And here. It was broken here.
Okay, is it okay if I palpate?
Yes.
Okay. So, I'm going to start. Is that sensitive?
Sensitive, yes.
Here?
Here.
Here?
Yeah, that's most sensitive.
Okay. Here?
Yes.
Here?
Less, but it is.
Okay, how about here? And here?
Yeah, that's
Okay.
yeah.
And here?
Ouch.
Okay. And here?
Nice.
Okay. Okay, so I'm palpating. It was on the lateral side of the leg, okay, behind the bone, going along the bone, and then it came in front of the malleolus, going in between the 4th and 5th metatarsal bone, okay? So what am I thinking about as my diagnosis? I'm thinking about the gallbladder. Because it was also behind the bone, a little bit behind the malleolus, I might have some bladder in there too. So if I'm looking at gallbladder, what are my different choices? Sanjiao, pericardium, and heart. Okay? Which do you think is going to give me my best anatomical similarity? Sanjiao. Okay, so we're going to start looking on the Sanjiao meridian. If I can have this hand. Okay. Going to go like this. So I'm going to start palpating from here. I'm going to palpate along the bone. Can you tell me where it's sensitive?
It is sensitive?
Yeah.
Yeah, that is also
Okay.
sensitive.
Here.
No.
Here. Here.
Yes.
Here.
Yes.
And here.
Yes.
But of all of those, was this one the most
Yes,
sensitive?
yes.
Okay, so we're going to start with here. Okay. I'm going to use a similar technique because I want to get close to the bone, right? So I'm going to pull, insert, bend, release. Okay. Now try and walk and see how your foot is now. Where's the pain now?
The first step, it was still there, and now it's gone.
Now it's gone.
Yeah.
Okay. So,
Can I hold it?
yeah.
Can I have it?
You're going to
Can I take it home?
I'm still going to go back and palpate to see if the Asher points that we found at the beginning are still gone, because that's going to give us, right? So, is that still sensitive?
No.
Is that still sensitive?
No.
Is that still sensitive?
No.
Is that still sensitive?
Yes.
Okay, so the one point that's still on the bladder meridian was still sensitive. Now I'm going to check going down the foot. Is that still sensitive?
Yes.
Is that still sensitive? Yes. Okay. So what we've been able to do there is we took the actual where the original injury was, and now it's the other things that were still there are still a bit sensitive. Okay? Well, what I'm going to do first is I'm going to finish with the gallbladder meridian, right? See if all of those points go away, and then go to the small intestine, to the bladder. Because if the bladder is a compensation, treating the gallbladder, which is where the original injury happened, might be enough.
Yeah, my question was the needle, not in the Sanjiao.
Actually, what happened is I'm in between the two bones, but because I turned it and I'm trying to touch the bone, okay? So if I was over here, I'd be on small intestine, right? Okay. So I'm going to take this again, and we're going to see here. Is that sensitive?
Yes.
Here? And here.
Yes.
So of the three, which is the most sensitive?
The last one.
The last one. So we're going to start with that one. Okay, so I go in, try to get close to the bone. Now we're going to see. Is that still sensitive?
No.
Is that still sensitive? Yes. Okay, so we're going to go to the next one a little bit higher up. Is that still sensitive?
No.
Is that still sensitive?
No.
And is that still sensitive?
No.
Okay. How about here behind? That's still sensitive.
No, just a little.
Just a little. Okay, so now let's take a look on the small intestine channel, just to take a look at the one that's still there. So I'm going to go here. Is that sensitive there? Or there? Or there?
The middle one.
The middle one. Okay. There we go. And is that still sensitive?
No.
What? Okay, so that was my treatment. So we used Sanjiao to treat the gallbladder. We used the small intestine to treat the bladder meridian. And as the pain was a bone-related pain, all the needles were close to the bone. Okay? Now, would I use a guiding needle here? Because the pain descended all the way to the end of the foot, I'm not going to use the guiding needle. If the pain was only at like the gallbladder 39 area, then I might have put a needle in gallbladder 43 or something. Okay? How does it feel now?
Feels okay. Yeah.
Perfect.
Only the little sore toes, like they're sleeping.
Like they're
They
sleeping.
have that all the time.
They have that all the time.
Yeah.
Okay. That's also probably because the blood flow wasn't working properly. That's something you check the next time if it's not getting better. And then if it's not getting better, then you have to keep going down the Sanjiao all the way to the bottom of the finger. But there's a better chance that because the blood flow is going to start, that the blood will come back to the toes and you'll have more sensibility there. Okay?
Yeah.
Good. So, okay?
Yeah, thank you. Very good.
Okay?
It was now opposite side.
It was opposite side because for gallbladder, I use Sanjiao, system 2, opposite side. And for bladder, I use small intestine, system 2, opposite side. Often with hands, system 2 is going to be our best choice because we're dealing with anatomical similarities. Hands and feet, the meridians are almost always in the right place.
The frequency that's really
Yeah. Sorry, just one other thing. So maybe, how often do you see this? Do you see?
No, I haven't
You're just a
done
French.
therapy.
Okay. Okay. So the ideal treatment would be 2 to 3 times in the first week, right? Second week, maybe 2 times again, and then start to reduce it. Because this is a foot problem, like we saw yesterday. You can't not walk. Well, you can, but it's inconvenient. So because of that, the frequency sometimes needs to be close together. Whereas if it's the arm or the hand, you can tell the person to use things less, and they can, then we can space it out a bit more. But she's going to re-injure it quite quickly. So more frequent treatments are going to be needed. Okay?